screen off. The only thing that will be on the screen are questions. Your voice may be there. So if you don't want your voice on video, you'll get a video, a link to this. It'll be in the chat box. Also, I'll send you a YouTube link. It's marked as unlisted, so you can access it if you have the link. So the whole wide world can't look at you. But most of the things anyway, just are really about, you'll see me in the questions. Okay. So just in general about the test, most of you know there are a couple of different types of questions. Okay, let me just make sure that I am sharing, chat box open, it's start. Okay, everybody see my questions?
Yes, ma'am.
Okay, and if your Wi-Fi is not so great, you might be a little time delay. But other than that, it shouldn't be a problem. Okay.
Just a little bit bigger.
I can.
Thank you.
We have to make it bigger.
Oh, I will. Believe me. I'm old people font. That's what my kids tell me. And I can't get rid of my pop-ups. I try so hard. Okay, so on the test, we have those recall-based questions. Those are the ones that you really just need to recall and understand the information. So let me take a shot at this one. A woman is referred to a social worker by her housing program. She reports that she has been on risperidone for several years with minimal side effects. This is a drug commonly used to treat what disorder? Somebody.
ADHD?
Nope.
A major depressive?
Nope. Running out of choices.
Schizophrenia.
Schizophrenia, yes. It's an antipsychotic. And one of the things that we know of antipsychotics is one of the side effects is tardive dyskinesia. That is when those little face motions come out. It is tardive dyskinesia. Okay? So that is schizophrenia, and those are things that you just kind of have to know. There are only a few medications on there, but the bigger ones you have to know. Okay? If I ask you what medication we use for bipolar disorder, what would you say?
Lithium.
You got it. Lithium is also one of the only ones that has to have monthly blood work. So those are keys when you're looking at that. So
I have a question.
Yep.
This one here actually gets me like every time. So I always remember Risperdal. That's
okay. So one is the brand and one is the generic. Risperidone is the medication. Risperdal is the generic. That's it.
But it's still for schizophrenia, because I remember my brother used to take it for ADHD.
He might have taken Adderall or Ritalin.
Oh, maybe it's Ritalin. Oh, maybe.
Yeah, because that's a pretty heavy antipsychotic. So that's not normally our choice. So probably Ritalin or Adderall. And speaking of which, that's one of the upcoming questions. Okay, but this is recall based. These are then application based. That means where I have to take what I know and then apply it to the question. Okay. So a 32-year-old woman seeks services from a social worker in private practice for issues related to her job. The initial session, she feels confused and ashamed about her behavior with her boss. She tells the social worker she dislikes her boss and disagrees with his management style and policies, but finds herself being overly nice and agreeable whenever they interact. This is the most likely example of what? And these are my defense mechanisms. So which do you think it is? Rejection.
Information.
And why is that?
Because she's feeling a type of way, but she's reacting in the opposite way.
How is she reacting differently?
Doesn't like her, but she's overly nice to her when she's around her.
What's that? And there's that one in sublimation.
Sublimation is when you transfer negative energy for the positive energy.
Sublimation is most often when I have there's something that's going on the inside that is not appropriately for me to act out. So sublimation would be, let's say that I really got some anger and I might want to like take my knife and stab people, and I choose to be a butcher. Okay, so I'm taking something that's not appropriate and then I
Figure out
am
problem,
doing,
right?
okay. Reaction formation is I'm taking the opposite reaction. I'm reacting differently to how I feel. So I'm forming a reaction opposite than what how I actually feel. Okay. Projection, I always reminds me of a movie theater. So, you know, the big projectors in the back. So I am projecting my thoughts and my feelings onto other people. So for example, if I think my dress is really ugly and I walk in the room and I see people talking, I'm assuming they're talking that my dress is ugly because I'm projecting my feelings onto other people. Okay. Okie dokie. And intellectualization also, that one is most often used with eating disorders. People who can intellectualize, who can somehow it makes sense to them that this I only need, like, you know, 3 ounces of food this week. So that is certainly what often happens with eating disorders. Again, 10 to 20% of those, and 10 to 20% of those. Then we have our reasoning based. So these are our first next questions. We're going to hold off on that one. We're going to come back to that. Let's just talk about in general some of the rules. Okay. So what I'll tell you is they are not hard and fast rules. Always read the questions, but these are some things that really have, the key is in the stem. Okay, so what most often happens is when it's a vignette, even if it's content-based, you read the question, and there are 2 that are definitely wrong and 2 that are close to right. So when you're coming to choose those 2 that are close to right, go back, read the question. Most often there's something in the stem that you're missing. Okay? So things you want to know is, what is a social worker's role? So in the question, are you a clinician, a colleague, a therapist? Where are you working? Private practice, hospital, clinic? Who is the client? Is it the minor, the adult, the child, the family? How is my client? What is their presenting problem? Okay, I have to be sure that I know what the question is asking me, because sometimes it'll give me that vignette with some stuff up there that really is not what the question is asking me. Okay, and again, the first, next, last, most often. Where is my client? Where's the location at? And what type of functioning? What am I supposed to be doing? Does it say, how do you build rapport? Does it say, is your client in crisis? It's all in the stem. And again, you'll get a copy of this, and you've got the video to go back if I speak too fast. Okay, and again, feel free to ask questions as we go along. You can type in the chat box, or you can just ask me as we go. Okay. If you don't know how to open your chat box, it is the one with the 3 lines. So it looks like a piece of paper, kind of. That's your chat box.
Do you know how to remove commercial advertisement?
I
Because
don't, I guess, but I do not. I go anyway. I've tried so hard. I think because I teach all day, Google just makes sure I get advertisements. So I will tell you, I am not a huge fan of the acronyms. A lot of people are. A lot of people live and die by them. I'll give them to you. I'm not a huge fan. So FARFI, that's the one most often people use. Feelings, assess, refer, educate, advocate, facilitate, intervene. Another one is aspirins. That's supposed to be for the best and most. Acknowledge, assess, start, protect life, intoxicate, do not treat, rule out, informed consent, non-judgmental stance, support parents, support patient self-determination. Okay, my rules. What I think is, it's always, 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 always assess. If I walk into a situation, I walk into my doctor's office and he hands me a stack of, or hands me a bottle of hydrocodone and didn't even ask me, isn't there a problem? Ask me, assess. Don't assume anything until you ask me. Assess before action. Always, always, always assess before action. When you're looking at those questions, look at those and read very carefully, because sometimes they'll trick you with explore or ask, other terms that make sure you read the whole sentence, but ask first. Always, always assess. The only time I don't assess first is if the client is emotional. If the question is filled with emotion, if they are boo-hooing, Acknowledge that they're sad. Acknowledge. The question will say, the client came in and he was irate. He was very upset because his wife was leaving him. The girl reported that she was so sad that it was hard to get out of bed. Acknowledge the feelings. If you go to the doctor's office tomorrow and you are bawling and you are so upset and he just begins to like write you a script, hello, ask me. So acknowledge the fact that something's going on, okay? Let's see here. What was that? Got that text right there. You said, if emotions don't access, acknowledge feelings first. Yes, exactly. So the question will tell you what you're looking for. So remember that always. So my thoughts, feelings first, if it's there. If not, I assess, and then I'm going to do some sort of action. And usually I've narrowed it down enough to what kind of action I can do. There are only 4 choices. So if you want to use all of them, feel free. I just don't always seem to feel the need for that. And then refer. There are 2 times that we always refer out. And to me, that's part of assessing. If the client comes in and they have a substance abuse problem, they come in and they haven't drank in 10 years, but the last 3 days they can't stop drinking. If that's the issue, always refer. I don't care how much experience you have for the test, you are not a substance abuse counselor. Okay. Also, if there's a medical issue, so if it says he's got a limp or a headache, something that's medical or a reaction to a medication, refer to the medical doctor. Those are all part of assessment, if you ask me, part of assessment. And you've probably heard differently. And again, whatever works best for you, but the way that I teach and the way that works well for most of my students, so just simply feelings first. If the feelings are not there, assess, then act. I refer twice. I refer when my when my client has a medical issue or when he's a substance abuser. Okay. So then some other things, and again, that's aspirin. This one is, are you safe? Rule out medical, under the influence. Do not treat. If someone comes in your office under the influence, do not treat. Save lives, assess before action. That's always me, assess before action. Feelings or concerns, and we empower. A couple of things. Build rapport. If the question says you need to build rapport with the person, that's usually validating or acknowledging their feelings. Okay. If there's a long list of 7 things to do on that list, she comes in and she lost her job and her baby's sick and her husband left her and she's thinking about drinking, partialize or prioritize. Okay. So, we decide where to start first. We're going to really kind of partialize. Oh my goodness, there's 7 things going on. Okay. Unless most often, if it's truly the substance abuse issue first, where she is, a crack user and all these things are happening because of her crack use, then I'm going to refer. Okay. Because if I don't get that under control, I can't do anything. Okay. Explore suicidal ideations. We'll talk a little bit more about that in a moment. Okay. The vignette refers out. We did that one. Substance abuse. Okay. If your client
I'm sorry, excuse me.
Yeah.
Can you explain that a little bit more with I think you use partializing.
Yeah.
If it's several things. Yeah, that's all.
Okay. Yeah. No. So many times the vignette will say, Sally Smith has, 17 things going on. She comes in, she's lost her job, she has no place to live. Her husband is abusive, a lot of, and not one is greater than the other. They're all lots of stuff. Then usually what you're going to do is your assessment is going to say something like, determine where she wants to start, or prioritize things, or help Sally determine which is the most important. Okay, that's part of that assessment, and it's prioritizing or partializing. Partializing is how do you eat an elephant, a bite at a time. However, if the situation is one where it's obvious that she's like a drug user or a crack user, and many of these things are happening because she's a drug user, then if I don't treat that, then nothing else will matter. So that's one that I refer out. Okay. And again, it depends on what the question is asking me and what I'm looking for, what baggage she brings, what stuff she brings, and what the question is asking me what I want to do or what they want me to do. This one is a contract. You can do a contract when you're suicidal. However, you don't ever contract on the initial session. In the initial interview, you don't know anyone well enough to contract. So we don't contract out for that. The question said, oh, that helps a lot. Okay. So, a couple more. As again, refer. The client is suicidal and doesn't have a plan, you refer for a psychiatric evaluation. There's a question I've seen a couple of times. And one of the questions says, she's a 20-year-old homeless and she's hallucinating, and the choices are like, find her a shelter to stay in, set up a doctor's appointment, call her family, and then walk her to the psychiatric clinic. The answer is the psychiatric clinic. And of course, in real life, most of us are not going to walk a client anywhere. However, she's 20 years old. You do not have the right to self-determination if you are in a psychotic episode. Okay, so you do not have that right. I can't hospitalize her if she's not in danger. However, I cannot let her say, I'm just going to go do this. She's lost that opportunity for self-determination if she's in a psychotic episode. Okay, if I let her go and try to get her to a homeless shelter, the odds are slim to none that she's not going to make it there. Okay. Advocate. There's a couple of questions in there that talks about, Johnny lost his job, or Johnny feels like he's been treated unfairly. And a couple of the answers are advocate. And we really do advocate. The code of conduct says that's what we do. That's one of the roles we play. So when they're looking for that, and we'll hopefully cover some of those today, you advocate. Okay. These are a couple of things you do not do. If the question has 1,000 things and they're happened in the past, Bob comes in and he reports that 20 years ago he was suicidal, and he has not had a suicidal thought since then, and refuses to sign the release of information. It's okay. Acknowledge those feelings. It happened in the past. It was 20 years ago. If there's no intent of suicide in the question, I'm good. I'm acknowledge the fact that he doesn't want to sign, and we're going to go on. Okay? We don't give advice. We don't judge. Many times recommend to a support group. That's like way, way down on the list. So make sure that we've ruled out all the other things before we look to recommending for a support group. We don't often make appointments. We usually get the client to schedule the appointment or help them schedule, but that's their job to do. Hand out pamphlets. That's that educate under the FAR fee, but again, way down at the bottom. So you have to really make sure that's all the things you've taken care of before you even look there. Okay.
I'm sorry. Let's go back to A. Advice giving. You mean it's okay to tell the client get a job because I
no,
miss it?
This is don't. Do not. Do not.
So don't give any advice.
Do not. Do not. And again, I'm not going to say hard or fast rules, but that's most often, A, we don't do that in social work in general, and B, the test that doesn't want us to do that.
Okay, thank you.
This one about inform parents, speak to the child. So again, this is the do not. Okay. So we, the child is still our patient. Okay. So we really are not going to, what's said in that for that session is confidential, even if mom and dad are paying, he is still our patient. Okay. And that comes back to the first one there is who our client is. So that adolescent is our patient. Does anyone know the term assent?
No.
So sometimes it will say, and especially on the clinical test, I've seen this one, mom and dad can give consent, but someone under 18 or unable to legally give consent gives assent. So if it's say again? Okay. I've seen a question that a 17-year-old girl was sexually molested. She's in therapy. The teacher asked if something is going on. Mother has given permission. Mother has given permission for you to talk to the child's teacher. Okay. And you want to ask the child for assent. And again, that's not legal permission, but that is her permission to say, hey, wait a minute, is it okay with you? This is your life. That's assent. Also, you'll see that with sometimes people who are unable to give the permission. Maybe they're elderly or something with a disability. So assent is one of those words. Okay. When can you terminate? Anybody?
I believe when they're already on like a sliding scale fee and
Okay.
still have not, held up their end, or say if you are moving and you cannot, there's no way you could still, see the client, or if they move, I guess.
Yeah, exactly. If they're gone, you can't see them anymore. That is so correct. Also, the rule is, the code of ethics says, if they lost their job, so you're going to say to them, okay, that we'll set up a sliding scale, or we'll work out something. So if they fail then to meet the financial burden they agreed to, then if they're not in any kind of immediate danger, then you can terminate. Okay. Often the question will ask, it'll give you a couple of choices, but you cannot, let's turn thought. So one of the questions says, do they refer them to someone else? So that is not part of termination. That's not your responsibility to refer them to someone else. You can, but it's not part of that. The goal is that you have to just have done what you're supposed to do. Okay. And they don't have to follow up.
So if we see that on the test, we don't refer them or provide referrals for them to go to anyone else.
You can. It's not it's not a mandatory.
Okay.
Sometimes it'll say, what are the 3 things that you have to do to terminate? So, and they can't be suicidal. You have to work out a payment plan already. And then maybe the client is moving. Those are the 3 things that are necessary. You can refer, but it's not necessary.
Okay.
Okay. When is the only time that you speak to, no, not the only time. The majority of the time that you speak to a supervisor is when you are having emotions, countertransference, transference that have to do in the session. Okay. So that's a big one. Make sure that your stuff is together. It's never go to therapy, because sometimes it'll say, your brother died and his brother died, and you're trying to figure out, you're emotional in the session. The answer is never go to treatment. Yes, go to treatment. However, it could take you 12 years to figure out, get your stuff together. You can't be doing that with a client. Okay, so you really have to go to the supervisor and make sure if it's a clinical situation, working out some transference issues, he might help you, refer to someone else, but that one always is, go to the supervisor on those issues. Okay. Again, you do not respect determination. You cannot give them self-determination if they're emotionally or mentally unstable. Okay. You can offer a contract, but not as a reminder. The contract is a safety plan, maybe, like, if you're in a situation again that you'll leave, it's for someone who's an alcoholic, you won't drink, a suicidal contract, we can do that, but not at the beginning of the session. You have to know a client long enough to make sure that you know them. Okay. We don't allow the clients to lead the session. We decide the topics. So it's their session. However, the question might say, and now he wants to talk about this, and it doesn't meet his treatment goal. So you're going to guide him back to where the treatment goal is, where you're supposed to be. Okay. And you always have to do something. You cannot not do nothing. Okay. So that's just not an option there. So is anyone familiar with this, the crisis intervention, Robert's 7-stage crisis intervention? This one has thrown a lot of people off. So when we use a FARFI or any of the things that we assess before we act, that does not apply to a crisis situation. This came up after 9/11. And now with all the mass shootings we have and things like that, this crisis intervention has been developed and is part of our repertoire. So the first step is to look for lethality. Is there still, are we safe? So is the client safe? Is the surrounding safe? What's going on? Are we safe? The second is you establish rapport very quickly. The third, if you can identify the last straw, and whether it's, asking the client what happened before you tried to kill yourself, or what happened before the person started shooting. Okay? We don't explore feelings until stage 4, which is really unusual for social workers because we're usually up here. So not till stage 4 do you actually explore the feelings. So that one, I see a lot of people get thrown off by that. So if it's a crisis situation, we are using this model, and it'll say in a crisis, the need for crisis intervention. So this is what we're going to do. And if it's suicide, most often, again, you're making sure the person is safe. Okay? And then the action plan and the follow-up plan. The goal of this, I've seen that question, what is the goal of this crisis intervention? It's to return the person to where they were. Okay, so go back to where they were before the incident happened. So that's the goal of it. But the steps are a little different than most of us are used to. Does anybody recall seeing some of these questions on the test and maybe didn't use this model?
Yes. Yes.
Okay. So it's relatively new. Again, it's, since like 9/11, where after it came out. In some of the newer study guides, it's there, but this is the model that we're using for crisis. Okay. Okie dokie. Questions about in general about what you're looking for. Have you got a test you've seen, a question you've seen that you thought there's no way that can be the right answer? Anybody? We're going to go over some test questions, but I just want to kind of see if you have any in general. Okay, so again, we're going to assess, assess before you act, unless feelings are high. If feelings are high, then I'm definitely going to acknowledge their feelings. Okay, I'm going to refer out if there's a medical issue or if there's a substance abuse issue. Okay, I always have to do something. And I'm going to refer to the Code of Ethics. There are a lot of questions that go back to the Code of Ethics. Everybody know the difference between a subpoena and a court order?
The subpoena comes from the judge, and the attorneys can just file a motion for the court order, which you don't have to appear unless it's a subpoena.
How about back the other way?
Yeah.
So the subpoena most often comes from the attorney, and the court order comes from the court, the judge.
Okay.
So, and the question can say, I've seen it said that the judge has issued a subpoena. If the judge issues a subpoena, that's the same as a court order.
Oh, that's what I was thinking of.
Yeah, if the judge orders a subpoena, it's the same as a court order. So a subpoena is an invitation. It's like, oh, would you mind coming over and sharing some stuff with me? You really don't have to answer, but you're going to answer. Okay, you're going to say thanks, but no thanks. So it's an invitation. It really is. If it comes from the attorney. If it comes from the judge, then I'm going to answer, and I'm going to answer with what? What am I going to say?
You're going to assert privilege?
I am. So that's called privileged communication. I'm going to say, Your Honor, the client I have worked on is confidential information, and I really feel like it's unethical for me to share this information. And the judge is going to say, I don't really care, Pam, share it anyway. And then I'm going to share it. So,
but we still will try to share just only limited information.
Only limited, exactly. That's what it's called, privileged communication. So I want to limit the amount, limit the scope. Sometimes you'll see that word, or limit that the amount I can give him. So I really want to say, Judge, go ahead.
What about if attorney sent you subpoena, like invitation? Do we have to respond it with a reason because it's confidential? We're not gonna come, or just we have to ignore it, not respond at all?
You do not have to respond, but most often I don't see that as an option. What I see is respond and say no thank you, or respond and say I can't do that. Acknowledge the person is your client. So I've not seen a question where it says don't respond. So usually it says, but you're not sending him any information. That is just a subpoena. Now, if it comes from a court order, that's a different story. I'm not going to jail for anybody.
Well, you know how,
go ahead.
I'm sorry. you know how when you do the couples therapy and then they get the
Mm-hmm.
divorce, so you'll see the questions on the test about the husband's attorney subpoena. Do you call the client first and let the client know? Do you call the attorney? Um, I
So
can't
if it's
remember what the other
yeah.
two, but it'll always include those two at least.
So what do you usually answer to that?
With the spouse,
Uh-huh.
I'm trying to think of what the other ones were, but usually you will want to let the client know, right? Because
Yes.
that's your client.
You will say thanks, but no thanks. And it might say contact your client first,
Mm-hmm.
but either way, you're not going to respond to that. I mean, you're not going to send information to a subpoena.
Okay.
So a court order, though, then some of the questions will say after the client's permission. So I am going to inform the client. I am going to many times ask the client for their permission. However, I'm going to send that information whether the client agrees or not. Okay, so that's a court order and I will go to jail. I'm not going to jail for anybody. But in the best of all worlds, the client would sign a release before I send it to the court.
But you only release the information that's not going to be harmful to the client. If there's
If the
something harmful,
client,
you don't have to, right?
it depends on what the judge asks. If the judge asks for the entire folder and I say, no, I'm going to assert privilege or I'm going to, this is a privilege. If he says send, I'm going to send.
Okay.
The caveat to that is when it comes to psychotherapy notes. Okay.
Right.
So no, a court order and a subpoena are not the same. So a court order is from the judge, a subpoena is from the attorney. Okay. But sometimes I've seen a question say, you've gotten a subpoena from the court. It comes from the court, then I am following, that's the law. I'm following the law. Okay. However, so and especially on the LCSW test, many times clients keep separate psychotherapy notes that are not part of the clinical file. So unless the release that she signs or unless the judge specifically asks for psychotherapy notes, I do not have to send those. So you have to ask for those specifically. Okay. So that's usually on the clinical exam. It might be on the LMSW sometimes, but those are separate. And the release has to say psychotherapy notes. Okay. So many times
If
agencies,
judge
go ahead.
asking for the notes,
If he asks for the file, unless he
okay, but client
specifically asks
denies.
for the notes. Oh, go ahead.
But client denies. Client
If a,
denies to give. But we
if
still
it's a
have to give
court
to the judge.
order, if
He
it's a
has to
court
do.
order, yes, I'm still giving it. That's what the Code of Ethics says. So yes, if it comes from the judge, I am still going to, I'm going to ask for permission. However, I'm going to. A subpoena, a subpoena really is an invitation. You do not have to respond unless it comes from the judge. Okay, it's like, oh, did you want to share those notes? No. So when it comes down, this is the NASW Code of Ethics, and you need to really be familiar with these if you're not. Most of those questions come directly and sometimes are verbatim from the Code of Ethics. I'm just looking for relationships, access to records. In general, with this one, since we're here, can the client have their records
Yes.
always?
Well, unless it's going to cause harm to them, then no.
Then what?
Access to the
You give them a little as possible. I don't know.
Yeah. So social workers should provide clients with reasonable access to records concerning their clients. Social workers who are concerned that the client's access to the records should cause serious misunderstanding or harm to the client should provide assistance in interpreting the records and consulting with the client regarding the records. social workers should limit the client's access to the records or portion of the records only in exceptional circumstances when there's compelling evidence. Okay, so the first one says that I should, if it causes a serious misunderstanding or harm, I should try to sit with them and try to interpret to them what I meant. Okay, so the other hand, it says when there's compelling evidence that such access would cause serious harm to the client, then at that point I should limit the client's access to records or portions. Okay, so that's what it looks like. I'm going to limit that. That's our code of ethics. Okay.
What about if client ask records for 5 years?
So most states have their own state laws. So it's usually 7 years.
So we have to give 7 years then.
If yes, you have to hold on to them.
And give it to the client if he said.
As long as there's not anything that will harm them. Even if it's 7 years ago, and the two choices, serious harm, then I'm not. I'll gladly give you this, Jenny, but it's a copy of the NASW Code of Ethics, but I will so gladly here. I'll put the link in the chat box right now.
And it has to be a written consent from the client?
It has to be a written consent from the client.
Not on the phone, like I call you, she's calling me and asks,
no.
send me my records. And
no.
I have to see the original, right?
I have to, yes, I have to have an informed consent signed from her. And most often your agency has their own, so you're going to have them sign your informed consent. Okay. Even then,
can it be faxed to me, or it has to be
it doesn't usually address that in the Code of Ethics. So it used to be that it could be faxed, and now if you have a secure email, so it has to be like one of those ones that says, on there that's secure, you can do it that way, but it has to be a secure email. And like Google and things like that are not secure. Okay, so just clarify this. So the question will say, does a client have rights to their records? Sometimes it says yes or no, or maybe yes or no. It's not ever yes or not ever no. Okay, so if there's a misunderstanding, then I'm going to sit with them. However, I'm going to limit their access to records or portions of their records if I think there's compelling evidence that access could cause serious harm to the client. Okay, so both clients' requests and the rationale for withholding some of the records should be documented in the files. So if you choose to withhold that, be sure that you document why you did that. Okay, and that's on the test. I've seen that a couple of times. Okay, I want to go back and address the court order and the subpoena. Okay, so let's see. We don't take advantage, no dual relations, protect the privacy.
If client sue me, I have to disclose his records.
If the client sues you, you have the right to control his records without his permission. You get the right to protect yourself. So if he sues you, you don't need his permission. Okay. Social workers should protect the confidentiality of clients during legal proceedings to the extent permitted by the law. When a court of law or other legally authorized body orders, social workers should disclose confidential or privileged information without a client's consent, and such disclosure would cause harm to the client. Social workers should request that the court withdraw the order or limit the order as narrowly as possible, or maintain the records under seal, unavailable for the client. Okay, so that's what it says. Okay, so a subpoena, and again, read the question. If it comes from the judge, if it comes from the attorney, it could be coming from anybody. So read the question about the judge. Okay. When it talks about the technology, social workers should protect the confidentiality of clients' written and electronic records and other sensitive information. We should take reasonable steps to ensure clients' records are stored in a secured location and the client's records are not available to others who are not authorized to have access. And then it goes on down there, it talks about technology. So yes, if you have that technology, if you're using that, then it needs to make sure that it is secure, password protected, not just regular over the internet. Okay? Barbara, you've seen that word for word on the exam. Yes, you have. Many of them are written verbatim. Okay? That's why it's important to know them. Okay? Any questions while we're here with the Code of Ethics anyway?
Dual relationship.
Dual relationships. Never, never, never. The rule is in general, if I've seen a client naked, I can never treat him. Whether that's a spouse, a boyfriend, a child, a mother, easy. If you've seen him naked, don't treat him.
And what about these gift rules? Like I've been listening to some videos. It's like
you
no more than
have.
$15.
That is not
like,
true. There's no dollar amount related to that. None. Let me stick here with a minute though. So conflict of interest, we talk about dual relationships. So there is a rule that says you can barter if that is if that's normal in the area. If everybody gets paid for chickens with chickens, you can get paid with chickens. Okay? However, you cannot. And then when it comes down to gift giving, the rule is it cannot be detrimental to your client. Let's see here. That's one.
Or an expensive value, right?
It doesn't talk a dollar amount. It just says you cannot. It cannot be. You should not. But if not taking the gift really would cause detriment to your clients. Let me see.
What about cultural respect? Is some
Hold on one
culture
second. Let me just look about constant. Word for word, it usually says like detriment to your client. That's when you cannot. That's what we're looking for. It's just this, and there's not a dollar amount. We've heard that forever, but there really is not a dollar amount tied to it. As a rule, we don't do it. We don't do it. The Code of Ethics, the question might say, you can never take a gift, and that's not true. You just cannot harm your client. What was your next question?
The question is like some culture will feel disrespectful if you don't accept the quote. I saw
Exactly.
I saw somewhere that questions. I don't remember that. Like
Exactly. And so, for example, culturally, many clients, a small token. I don't know if you're common with the Bible, but the widow's mite. So for her, it meant a whole lot. So it was a little bit, but it meant a lot to her. So that's what I think about when it comes to a gift. If that means a lot to my client, that's a big deal, and not money-wise, not money-wise. When I was pregnant with one of my children, a client knitted an Afghan for me, and I could not take it. This woman had spent hours and hours and hours. For me to not take it would have been much more harmful to her than me taking it. And it does talk about that. We can't cuss at our clients. We
but you
can't
have
sleep
to
with
share the
anybody.
gift with the agency, right? Like
No.
no.
If it's a big gift, that's a suggestion. If it's a big gift, you say, please send it over to the agency.
Or if like box of candy, you could keep it for yourself. Right?
I'm always going to err on the side of caution. So I'm always going to, it talks about always avoid the look of inappropriateness. So you're always going to avoid that look. That's what I want to do more than anything, is avoid the look. Okay. This one's on there also. When they're dead, the rules are the same. Okay. So if a client dies, that's still the same confidentiality. You cannot share his records even if he's dead.
What if like if they divorce, if they get buried and they get divorced, so you need to get like new permission from each client.
Is she dead? She's dead. he said.
No, I mean divorce. What
So
if husband and wife?
No. If they're divorced, then both of them have to give permission. Okay. Let's see here. Dual relationships, conflict of interest. You have to be culturally competent. Okay. I will find
Conflict
that
in
and come back to
interest,
you.
like a conflict in interest, how to like remember this dual relationship and this difference in conflict in interest.
Conflict of interest is anything that I would benefit from or somebody else would benefit from. So if the teacher, my daughter's teacher, is one of my clients, that's a conflict of interest. However, what the Code of Ethics says is sometimes they're unavoidable. If they're unavoidable, then I'm responsible for making sure that no one gets hurt. That's my job as a therapist, the counselor, to make sure no one gets hurt. Okay, let's do a couple of sample questions here. So number 1, that's based on the state. What's based on the state, Jenny?
As far as how many years they have to keep the records after
Yeah,
the client dies.
you got it. That is based on your state. The Code of Conduct does not give us a record on that. And even your agency too. Sometimes agency have separate rules. Okay. So a client comes to see a social worker because she's having multiple issues on her job. During the initial session, she tells the social worker she can't wait for advice on how to fix the problem. In this situation, what do you do? Okay, so there's not a first in here. This is just kind of, you're sitting in the office, pretend you're sitting there, and the client comes in and she's rushing in. It's the first session. You just met her. Oh my gosh, I am so glad to see you. Please fix all of my problems. What do you do? A, B, C, or D? Let's see some chime in.
I would say
A for
D.
sure.
D, D, D. D is correct. I'm going to clarify what will happen in treatment and the responsibility of both the client and the social worker. I'm still looking for the magic wand. Anybody find that yet? Okay, so exactly. I'm going to say to her, this is what we can expect. However, there's no magic wand here. Okay. If you've had me before, anytime, you know the answer to this. How many races are there? Not how many people are racist, but how many different races do we have?
3.
So you've had me before. The answer is 3. So they are Black, white, and Asian. Those are the only 3 races. Okay. Anything with asking why it's offensive. I don't understand that question.
Well, I was just talking. I'm trying to give Sophia a little bit of. She answered C, but I've been told
Gotcha.
thing about like asking the client why, they'll take offense to that. So that's why it's a no.
And you usually don't ask why questions, right?
Right.
And this is a purposeful question. Let me just so what we know, what you've most people been taught is the first thing you do is assess, right? And many times when you're assessing, the question starts with ask. So this is a purposeful, tricky question, because if you've been taught to follow the acronyms where you assess and you ask, then many times you see ask first and you're not going anyplace else.
Right.
Okay. So that when it says it's tricky, that's the kind of trickiness you see. Okay. So just because it says ask doesn't mean that's the initial assessment. And also it doesn't say, what should she do first? It says in this situation. Okay. So that's why the ask is written there, and that is purposely tricky. But back to this one. So yes, there are only 3 different races. There are Black, white, and Black, white, and Asian. Everybody else falls somewhere in those categories. So you can be Black, my skin color, and you can be speak Spanish. You can be Black and you can speak French. You can be. So it's not about the race is based on the hue of your skin, as well as your body structure. So if you see on TV, one of those, all the shows, they dig up a dead body, they find a dead body with no skin, and they say, oh, she's a petite Asian female. How do they know that? Because that's a biological, so race is biological. Ethnicity and culture are what we choose, how we see ourselves, but not race. Okay, anybody recall seeing this question on the test?
I do, and I don't remember. I don't think I got it right because I still don't understand it.
because race and ethnicity are not the same. So, which of the following is true about the relationship between race and ethnicity? Individuals who are the same race are always part of the same ethnic group? No. Individuals who are the same race may or may not take part of the same ethnic group. Individuals who are the same race are never the same ethnic group. Race and ethnicity are synonymous. Okay, so what's the correct answer?
I don't know.
Well, let's rule out. Race and ethnicity are synonymous? No. Synonymous means the same. No, not the same. Okay. Individuals who are the same race are never part of the same ethnic group. Be very, very leery of things like always and never. All those are usually not the right answer. Okay. Individuals who are the same race may or may not be part of the same ethnic group.
Yeah,
It
I would
is B. Okay. So your race, if you are, born in, Texas, and you are white American who was born in Texas, and then I have someone who is white and lives in France. Are you the same ethnic group?
no.
No, you're the same race, but you're not the same ethnic group. Okay. So just understand there's a difference between that. There are only 3 races. Sometimes you might see 4. It might say Native Alaskans or Native Americans. Can say we're the indigenous people. That is it. Are A and C more of stereotyping? I think they're not. I think many people just assume that race and ethnicity are the same, and they're just not the same. So I don't think it's purposeful stereotyping. I think it's just lack of education. I'd like to think that. Okay. So this is a best question. So the best question, does anybody have any clue of how to answer those? The best?
It says Aspen, but I don't like using acronyms.
Okay.
So it's always more than one right answer.
Exactly. So it means there's more than one of those is right. So I'm looking for the best of the right answers. So these are tricky when it says best. Okay. So when collecting sensitive information in a social work interview, it is best to, and again, A, inform the clients that answering sensitive questions is optional. B, reiterate limits to confidentiality, which may require the release of the sensitive information. C, offer the opportunity to provide the sensitive information anonymously. Or D, ask sensitive questions in the latter part of the interaction. Okay, so what is the best? And let's go by ruling out. So A, inform the clients that answering sensitive questions is optional. Is that true? Yes, no?
Yeah.
It is true. And I can say that. I'm going to ask you some things that, you might not want to answer. That is true. Okay, so I'm going to keep that in there. Reiterate limits to confidentiality may require the release of sensitive information. So reiterate just means to repeat. So to say to them that the limits of confidentiality may require the release. If you want me to share something, that I may have to get you to sign a release. Is that true?
Yes.
Yes.
It is. That is, so A and B are true. C, ask the opportunity to provide the sensitive information anonymously. Is that okay? Can we do that?
Yes.
I guess we could.
Get a release.
Anonymously though, like how's that going to happen? Ask sensitive questions in the latter part of the interaction. Is that true?
Yes.
It is true. So now I've got A, B, and D. So of those 3, which is the best thing to do?
I would say
B.
B.
The answer is D.
Really?
Ask sensitive questions in the latter part of the interaction, because if I'm collecting sensitive information, do I want to start off with, oh, excuse me, could you tell me how many times you and your husband had sex last week? Wouldn't that be better after establish some rapport?
Mm-hmm.
Perhaps. Can you tell me, you were sexually molested as a kid? Give me details. maybe after I get to know you a little bit better, maybe later on in the interview. So yes. So the best thing to do is D, ask the sensitive questions in the latter part of the interaction. Okay. I've taken some time to build up rapport. We've gotten to know each other a little bit. Okay. The other three are options. They are okay, but D is the best answer. Okay. Questions? Okay, I'm gonna push this one down. Oops. I think I see a question there. Hold on. That's a good question. Well, Safet, I wrote it myself. I did not. I've copied this most from every source out there. I tried to pick the ones that are the most difficult and the ones that most of my students just have difficulty with. Okay. Here we go. So upon intake, a client states that she feels like hurting herself, but will be fine. She assures the social worker that she will not act on her feelings. In order to best assist the client, the social worker should first. Okay, so it's a first question. However, my first question also then includes someone who is in danger. What do I do first? A, B, C, or D? Chime in.
Oh, A. You want to assess the suicide rate.
Exactly. I'm going to conduct a safety assessment, okay? Which, again, goes back to my triangle. I'm looking at I'm doing a crisis assessment, lethality, safety, okay? So many times you've answered the question because we've been taught to do in social work, of course, but if we're using the model, that's what we're going to do. That's exactly what the model says. Okay? Good, guys. Okay. Let's see here. Okay. A school social worker asked the parents of a boy who is Asian to come in for a conference because he has been experiencing problems at school. These problems include not obeying rules and deliberately annoying others. The grandparents of the boy come to the meeting with the parents. Their presence most likely can be viewed by the social worker with an indication that before you answer the question, when they say that he's Asian, it matters. They didn't just put that in there just because he is Asian. What do you know about Asian families?
They are not emotional.
They don't show emotion. They don't show emotion. They do not. You're correct about that.
And they really don't like to involve people in their problems.
Exactly. Don't be sharing our business. Okay. Many times not eye contact, especially with children, because that's considered disrespectful. Okay. So the Asian people, especially, and many times our Chinese families, they are it's the term collectivism. They live together. In the Chinese culture, it is actually the father's responsibility to take care of his parents. Okay, so that's why the whole issue with people not wanting a girl many times in China, that one child rule. But in addition, that's his responsibility, and the Asian culture hold responsibility. That's very, very important. There's a term called I'll Google it. I'll put it up for you. But it means that the family as a whole, that we are one piece, and anything that you do affects the entire family. So knowing that, is it odd for the grandparents come to the conference?
No.
No, it's not. It's really not. It's not, okay? But knowing that before you answer the question, then helps you look at the answer. So things like this, you want to kind of have an idea of what you're looking for, and then which one of these best answers now what you know. You got some answers in there? You got it. You got it. Okay. I don't know if you're familiar with this term, filial piety. Do I know what that means?
No.
No.
It really means
No.
that we are, and you might see it. I'm going to show you an example of it. I have two screens. I'm just going to open it up in a different screen. I'll give you a picture. It's not. Okay. What it really means is that the father is the head of the house, and also that we are going to make sure that we're included. It is the being a filial son meant complete obedience to one's parents during their lifetime, and as they grew older, doing the best to take care of them. So the son's responsibility is to take care of his family. It's most common in China, but it's also most Asian companies, most Asian populations. And as a rule, if you do anything that is a embarrassment to your family, embarrassment to you, you embarrass your entire family. Now we as Westerners, we can see that, we're embarrassed because our kid did something, but a kid who does something is a disgrace. It brings down the entire family name. So understanding how important that is for many Asian cultures is something to answer this question. And of course, we do not want to assume that every Asian family thinks this way, right? We do have to have enough information to know that when they bring their family to school or bring their family to the conference, they've embarrassed the family. There's a problem here. I was a school social worker in one of my lifetimes, and we had a lot of like Asian doctors who would come, and I did a lot of truancy issues. And what I noticed is many times if someone in the family, the mom or someone had a baby, the kids stayed home. The family would come over from Asia, Japan, wherever they were, and the kids would stay home with the whole family for a month. And I have to explain to the parents that, in our culture, that's not appropriate. Your kid had to come to school. But when something happens, the whole family's involved. Okay? So the grandparents, if he's having a problem at school, they're embarrassed. The whole family's embarrassed. Oh, who's got a baby?
Sorry.
I want one. I want one. Not really. I want a grandchild. Let's look at this one. A client abruptly stopped coming to sessions after 6 weeks. He calls the social worker and asks for a copy of the records about a month later. There's nothing in the record that's harmful to the client, but the social worker refuses to give it to him. In this situation, the social worker's actions are what? Okay, and before you answer the question, what do you know?
Do you need a written consent?
It's his own records, and yeah, he does need a written consent. But the Code of Ethics says when do I not give it to him?
He
he's
terminated therapy himself.
Yeah. Okay. Is he in danger? Do we see anything that he's in danger?
No.
There's nothing in the record that the harmful to the client. He doesn't seem to be in imminent danger. So can he have his records?
Yes.
Yes.
Yes. Okay. So in this situation, the social worker's actions are what? She refuses to give it to him.
Unethical.
Why? So now we've ruled out two. We've ruled out C and D. So if it's we've ruled out A and B. So if it's C or D, then which one is it?
C. In this situation.
I can't see the whole question.
Oh, I'm sorry. Hold on one second. Let me just answer this and I will go away. Okay. Okay. So we know it's unethical. Okay. But why is it unethical?
Because in this situation, she has the right, or he has the right to get his records.
So it'll be C.
You got it. Anybody got somebody concerned about that? Why is D wrong?
Because it says under all.
Exactly.
All circumstances, but it's not those. So answer is C, right?
Okay. So that's not under any circumstances. Okay. Here we go. What's the rule when it comes to the Code of Ethics? What does it say about impairment? If I got an issue with my colleague, what do I do?
Oh,
You talk to the colleague.
Go to my colleague. Exactly. Go to my colleague. Okay. So again, this one then. What's the answer?
D.
D.
Okay. So when a social worker has direct knowledge of a social work impairment that interferes with effective practice, the social worker should first consult with a colleague. Always go to my colleague first. The only time I've seen that answer not be true is when there was an answer. Hold on, answer. Hello?
Hi, I was trying to get into
I know. I'm going to have to look. Okay, if you'll stay right there, I'll send you a link. Okay? Uh-huh. Okay, if I think I just quit that Skype. Yeah, okay. Let me just send her a link. So anyway, I've seen a question that says, I have one brain cell, so I can't do two things at once. I have seen a okay. I have seen a question that talked about a client who was he was a pedophile, and somehow he had escaped the law, or his background wasn't caught. Okay, and then so when that happens, then do I go to my colleague?
No.
You have to report.
Exactly. And even the question with that one is why I go to my supervisor. So I don't go, I don't go to the police. I just go to my supervisor and say, hey, wait a minute, this is what's going on. Okay. So always go to my colleague first. Does anybody know this one? I've seen this a couple of times. That's one of those human behavior questions. Oops, hold on.
Я ж тебе сказала, внизу.
Which of the following
Внизу. Где мой телефон? Подожди.
is not, if you're talking to someone else, please mute.
Сама сходила, надо поспать. Сейчас через полчаса выйдем.
Can you mute yourself?
Ножки накрыла ему, подожди.
Which of the following is not a symptom of Wernicke's encephalopathy or Korsakoff's syndrome?
Diabetes.
Does everybody know what that is? Anybody want to be brave enough? What are those syndromes?
I think the Korsakoff, isn't that when you have too much of some type of medicine?
It's usually, so encephalopathy in general means brain. So it's like a swelling on the brain, and Korsakoff's is, again, one of those syndromes, but they affect your cognitive functioning. Okay. Yeah, Korsakoff is due to substance abuse. You are correct about that one. Okay.
So
Okay.
the answer is what, D?
The answer is D. Yes, diabetes. I'm sorry.
Okay.
Okay, that should be the link. Just click it and you should be able to get in. I can invite her from the other way. Okay, this one. And I've highlighted this one this time because so many times I have seen clients, students miss this question. Okay.
Look at these type of questions. I remember on the exam, it's always saying like, what approach would you use, or I don't understand those questions.
So if you don't know what systems is, then you're going to totally miss the question, right?
Right.
So what is a systems approach?
Like a little bit of everybody. I don't know.
No, it's not.
That's the problem. I don't know these.
Exactly. Okay. So what is family systems theory, Jenny? Give me some terms that goes with it.
Is that the one like with boundaries and stuff?
Come on, you're there. Come on, yes.
Boundaries, triangulation.
You got it. You got it. So family systems theory in general talks about there's a couple of like our strategic, our structural, Murray Bowen, some of those names. Okay. The systems theory in general says that, let me make sure she got in. The systems theory in general says that we follow a system, that everything is a system. What I do is, like when I look at a bicycle, So a bicycle has 2 tires, and if you get a little bitty break in the link of that chain, what happens?
It breaks.
It breaks and the bike won't run. So systems theory says that everything is part of everything, that everything is a system. Okay. So when we look at, again, family systems theory, some of those terms you use are absolutely correct.
That's what I think I meant. Like everything kind of links to.
Okay, I got you now. I got you now. Okay. So boundaries are a big deal. So when we have, I can just do this one in general. Okay. So boundaries are a huge deal. Does anybody know the term entropy? I'll put it up here. ENTROPHY. And I know you've seen that on the test.
Is that like
Entropy.
a closed systems group or something?
Well, do you know what the word means?
I don't know.
You're right. You're absolutely right. Entropy means to shrivel up and die. PHY. Okay. So I am an expert at that because many of my plants have entrophied. They have shriveled up and died because I did not take care of that system. Okay. So what happens in general, that's a term that many people see on the test and don't know what it means. It really has to do with systems theory, that if you have a closed system, so for example, you have a mom and a dad and 2 kids, a closed system, dad's an alcoholic. They never let anyone in their circle. It's very close. Okay. Eventually mom and dad die. If kids have never let anyone in their circle, what happens to the whole family?
It dies.
It does. It's gone. So a closed system entrophies. That's what that means. Okay. Negative entropy is a good thing. Okay. Negative entropy is when it doesn't entropy. I let people in. Okay. So I let people in my system. It stops the dying. In an open system. You got it. Those are systems terms. System means that everything is related. The family systems term did come from the systems theory, an organizational theory of how systems work. So that's what we know is everything works together. If a piece gets broken, a piece gets left out, then the whole thing just doesn't work. Okay, go back to that one. Okay. Just some terms. So, families are a unit, families are systems. Okay, I'm just going to give you some of the keys there. Minuchin is, so when we talk about family systems, usually structural and strategic are included under that big umbrella. And we'll talk about those at a different time, but just know that you understand systems and boundaries. That would go, boundaries. So boundaries, rigid boundaries are those ones that are very, very close, don't let anybody in. Diffused boundaries are when there's no clear boundary between anybody. Incest is highly common in enmeshed families. Those are families that are diffused. And I've seen that one on the test. Walking in on others in the bathroom, rummaging through personal effects of others, not listening, interrupting, name yelling, name calling. Those are things that is extremely, that's where we see our incest, because there are no boundaries. I'm not sure where you begin and I end. The term differentiation, that's one of his terms also. It makes sure that I know that I'm a separate person than you. Subsystems, mom and dad should be a subsystem and children should be a separate subsystem. So all of those terms come from systems. So this is really a content question. It really is not a question about, that's not it. It's not a question about first or last unless you know the content. Hold on, I lost that other document. Here we go. Oh, my Word documents just keep getting lost there. Just close out everything. Sorry about that. Okay, questions? Want to try to pull these up? Close Word and come back out. Okay. Questions in general that I can answer? Okay, well, I lost that one. Let's go back to a different set of questions. Okay. These are just some old questions from an old test. You'll see it's just old. Okay, so number 1. A social worker employed in a residential youth service agency learns that a fellow employee has multiple convictions for sexual molestation of young children. The agency is unaware of his history, though he was asked pre-employment questions about previous convictions. Sexual offenses automatically disqualified applications for employment in the agency. The social worker, okay, so then the social worker's professional and ethical obligation is best met by, I think I just asked you that one. What do you do?
3, immediately notify.
Yeah, exactly. Immediately notify. Okay. This one in general, this was one also we just kind of talked about a little bit. Okay. Salvador Minuchin and others have written about the families of delinquent boys who live in poor urban neighborhoods. Parents find it difficult to maintain an emotional connection with these children or to assert parental authority. Since anti-social activities and peer pressure are powerful countervailing influences, the most precise family system concept is the most precise family system concept that contributes to the understanding of the family phenomena is what? Okay, before you answer, what the heck is that question? Ask me. Look at all those words in there. What is it asking me?
I would say boundaries.
Okay, okay. So why are you saying boundaries? What in the question makes you see that?
Here it says, they find it difficult to, oops.
Yep, I got you there. Go ahead.
It looks like, because it says that if they find it difficult to maintain an emotional connection with these children, I don't know. I guess I think
You're on the right page. You're on the right page. Okay.
They just have to, I feel like they have to set boundaries within, you know, the children. I don't know where I'm going.
Okay, okay. So the question though is asking me then, what is the understanding? So Salvador Minuchin, that's a key. That's a key. So he's a strategic family systems guy. So you need to know that. And again, so I'll do a session. We'll do more sessions on kind of how to recognize these theorists and who they are. But that's who he is. So that he has written about families. And even if you didn't know, you should be able to kind of maybe guess. Parents find it difficult to maintain an emotional connection or assert a parental authority. Okay? So if I don't have an emotional connection to my child, is that a problem?
Yes.
Yes. Give me some guesses, guys. What do you think the answer to this one is?
Number 1.
And it's not boundaries.
Yeah, disengagement, I guess.
You got it. Disengaged. Okay? So is that an open or a closed system?
A closed.
Closed system.
Oh, it is like way too open because they don't have those subsystems are not good. The mom and children should be in a subsystem, children should be in a subsystem together, parents in a subsystem. This one, these boundaries are all messed up. So it's way too open if they're disengaged. Okay, so rigid, They're just way too open. The Columbine murders, now it's been like 20 years, but so those are disengaged. We see those with our higher end families, families who make buku bucks, or families who make no money. The families who make no money, mom's trying to work and keep her act together. And the families who have lots of money, then give the kids the car keys and say, go away and have a good time. So the Columbine murders, the kids were in the garage making a bomb. And even if mom didn't have any idea what they were doing, healthy parenting would include going out and checking on them occasionally, right? If your kid spends that much time anywhere. Okay. So you asked me which are open and closed. So a couple of things. So in a family should have an open system, but the lines should be appropriately open. The subsystem should be mom and dad. If I can show you that.
But wouldn't that, so disengagement isn't a closed one because they're disengaged? Wouldn't that be a closed system?
The children are closed off from the parents. So the subsystems are unhealthy. Does that make sense? So the whole family, when we think of a closed system, that nothing is getting in. So the children and the mom was closed off from her children. Those boundaries were very closed. Yes. Okay, that system was a closed system. However, the family in a whole probably was an open system, but those the closed system with the kids, those subsystems, was not healthy. Let me just kind of show you what that looks like. Okay. This is sometimes what we see if you did like the genogram back in the day. That's one the image. Okay, so back in the day we had to do, not do that either. Just make it easy for me. I'm gonna do this one. Okay. So the first question I talked about was kind of the entire system as a family, and the family that's a closed system is an unhealthy as a family. That family system as a whole will kind of shrivel up and go away. Okay, so this one talks about in general what boundaries and subsystems look like. Okay, so healthy boundaries. I've got a boundary. You know, I've got some people can get in, some people get out. I'm not totally closed. That's a pretty healthy boundary, right? You're not all in my business. I'm not all in your business. A family would look like that. You know what? That the kids have the rights to some privacy. The kids, they can have their cell phones without mom and dad going through them or checking on them every 15 minutes. As a rule, you shouldn't do that unless you have a reason to believe something's going on with the kid. So that's a healthy boundary. Mom and dad sleep with the door closed and locked so mom and dad can have mom and dad time. Healthy boundaries, okay? So then unhealthy boundaries, and we talk about what happened with the Columbine kids, is this there was almost no boundary, okay? The kids kind of did whatever they wanted to do, and mom and dad really just weren't in there at all, okay? So loose boundaries also. Okay, so my non-existent boundaries also are then just very unhealthy when it comes to seeing what's in there. And then rigid those are my wall boundaries. Those are my closed systems. So systems don't want to be rigid either. They just want to have some good amount of boundaries. The boundaries should be between the two subsystems. Mom and dad should be a subsystem. Mom and dad should have a closed system with the kids. And I don't mean like they never show anything, but there should be things between mom and dad that don't include kids. And then kids should be a system by themselves. But together, then the boundary should be very healthy between mom and dad and the kids. While we're there, we can talk about triangulation. Do you know what that means when it comes to these families?
Yes, when like a mother and father is trying to like put their child in the
You got it. You got it. So that changes the system, doesn't it?
right.
Okay. So what happens many times is then in that system, mom and dad are fighting. Mom will say, "Come here, kid. You know your dad was late last week. You know he never, you know." So that's triangulation. That again becomes an unhealthy boundary. Okay. So healthy families have healthy boundaries. So disengagement is when we're not engaged at all. Triangulation we talked about. Sibling subsystems, that's what's healthy. The siblings should be a subsystem that don't include mom and dad. Okay. Let's do this one, number 19. Remember, when it says they're Latino, it's there for a reason. Okay. What do the people who are Latino speak?
Spanish.
Okay, so make sure everybody knew that. I taught a girl last week and she said Latin. Okay, so Latino and Hispanic many times are South American countries. Depending on the client, if they define themselves as Latino and Hispanic, but those are usually Spanish-speaking countries. Okay, so 19, a social worker is assigned to work with a Latino single-parent family. The 29-year-old mother has difficulty controlling her 10 and 12-year-old children. The problem begins when the grandmother, who resides with them, became ill and able to care for the children. The children are unruly and occasionally truant. The first objective, okay, so before we do anything, what do we know many times about a Latino family and the grandmother being there?
That's normal.
It seems a little abnormal because there's only the grandmother. Many Latino families have the whole family in the house, right?
Oh, just the grandmother?
I'm just saying, I was laughing.
Oh.
Yes, grandma's in charge. Grandma's in charge. Yes, Jenny. But just in general, many times it's not uncommon to have, lots of your family, a familia in the house. Okay. So yes, but grandma was in charge. That is what happens many times. If she's a single mom, grandma said, "You don't know how to raise these kids." So now that grandma's sick, who's in charge?
The kids.
The kids. You got it, the kids. Okay, so now that we know that about Latino families, now look at the question. What are we trying to do? What is my first objective? So it doesn't say what do I do first. It says what is my first objective?
I would think 4 maybe.
Form a relationship with the mother. Other people? Go ahead.
No, I was gonna say it emphasizes on the mom's inability to control the children, so you're trying to help the mother.
You got it. You got it. So I'm going to decide if the children are abused or neglected. Is that my objective here?
No.
No.
No. And again, the question is asking, what is my objective? Okay. It doesn't ask me what to do first. It doesn't ask me, what steps should I take? It's asking me, what is my first objective? And my thoughts again, a Latino family. How often do Latino families come to counseling?
Not often.
Not often.
Okay. So when I call mommy in and tell her that, hello, you've got a problem with your kids. I need to talk to you. How's mom feeling?
Down.
Embarrassed.
And terrified. Many times, even if she's here legally, there's all these thoughts going through her head. Oh my gosh, you're the government, you're the bad people. She's terrified. Terrified. It's bad enough she can't control her children. Her mother is dying. So she's in a really rough place right now. Okay. So then, decide the children are connected to abuse. I don't want to do that. Meet with the teacher and the mother and arrange after-school activities for the school. Is that my first objective?
No.
Nope. Ask the mother if she wants to go to court with the children and have the judge try to help her by declaring the children in need of supervision. No. I want to just build rapport, form a relationship with the mother, and help empower her to manage her relationship with the children. Okay. Is that one pretty clear? Would you have gotten that one right?
Yeah, it was clear.
The key to that one is, again, that objective is what it's asking me. Okay, let's see here. Let me go with this one. Okay. So the answer has to address the last sentence. It's always the case. Sophia, the problem with that is many times people will go back and read that last answer, that last sentence, and that fully doesn't do it. I've heard that. I'm not a fan of that because sometimes it's the last two sentences. I just need to know what the question is asking me. And if I can get that in the last sentence, that's fine. But I don't always guarantee on that. I've heard that a lot. Okay. 23. A social worker in a mental health agency is working with a client who constantly complains about her husband's compulsive gambling and the financial deprivation she experiences. He owes money and has been threatened. Her discussion and complaints often emphasize her husband's irresponsible behavior. She seems too distracted by his gambling to focus on her own needs. The social worker should. Okay, before we answer. Okay, so what's going on? Who's the client?
The wife.
The wife, okay. She comes in complaining, my husband spends all the money, he's gambling, we've got no money, I don't know what to do. He owes money to everybody. She discusses, she seems too distracted by his gambling to focus on her own feelings. So then, what am I trying to do?
And there refocus her so that she's not focused on his feelings.
Exactly. See that? Okay, so when I say the answer is in the stem, that's when it wasn't the last line, because we get up here with all the stuff about the husband gambling. They've got no money. What is she presenting with?
She's stressed.
Her stuff. We've got to work on her stuff, and this is a common one that we would see. Okay, so then if you're not going by this part, we might then suggest that, well, we're not going to suggest referral because that's one of the rules, right? I'm not going to do that first ever. Do a suggest referral. Okay. So number 2, ask the husband to come to see the social worker. We're going to do that?
Oh, he's not our client.
Exactly. We might do that, but are we starting there?
No.
No. Suggest the wife consider separation as his behavior is unlikely to change. His behavior is not going to change, and we all know that, right? Until he goes to Gamblers Anonymous. But that's not what we're here for.
Okay. Advice.
Exactly. You got it. So number 4, determine with the woman how to refocus treatment on how to discuss her own feelings and concerns. Okay. Do you have a better understanding of what to look for in the question? Okay. And again, many times with my students, what I'm finding is they're not getting all of the small, minute details in the question. Okay. And once you understand what it's asking, it really kind of, then you narrow it down to 2, go back to the question. Okay. I'm not going to pretend that you don't have to have any content knowledge. Yeah, you have to have some content base. There are a lot of Piaget and Freud and a lot of questions on there regarding theories. So you do have to have that as well. But a lot of it really is just understanding what the question is asking me. Okay. So I've got a 26-year-old man who's lived with his parents. Though employed, he makes a low salary, and his current job is likely to be of limited duration. He has some health problems, including a stomach ulcer that requires special attention to his diet. He informs the social worker that he wants to move so he can be more independent. He asks the social worker to help him in meeting his goal. Okay, so who's the client?
The man.
6-year-old.
And what's wrong with this man?
He wants more independence.
He does. He's got some medical issues, though. He's got a stomach ulcer and he has to watch his diet. So he tells the social worker he wants to move. So What do I do? Is this one where is there a reason why I cannot help him with his goal?
No.
No.
Okay. It's a first question. So first question, I do what? On a normal first question, what do I do?
Assess.
Assess. Okay. So let's start there. Is assessing my answer on this one?
Lower.
Yes.
Okay. So which one, what answer would you choose?
Number 4.
Okay. You got it? I'm not going to give him information because I don't know enough yet. Help him seek ways when he's still dependent on his family. You know, I don't know enough. Suggest to talk to his family. I don't know enough. I can't do anything until I know more. Okay, so let's talk. That's the same situation. I go into the doctor's office and I say, doctor, you know, I'm really pretty sure that I'm pregnant. And he says, well, okay. And he refers me over to the gynecologist. Did he even give me a test? Did he even assess if I really was pregnant? I'd be like, doc, hello, let's at least start with assessing me. So it's really kind of use that thought process. Always, always assess. Good job, guys. Good job. Um, 28, just because it's a Freud question. Social workers who function in case management positions are usually most directed to enhancing which of the personality structures that derives from Freud's theories. Okay, so how do my id, ego, and superego work? Somebody tell me.
Well, the it is like pure pleasure.
It is. You're probably not old enough to know, but Janet Jackson had a song called Pleasure Principle. Oh, okay. So that's my pleasure principle. Freud would say it's my desires, my drives, my wants. And those are to eat, sleep, and procreate. Okay. So then my id, and then what does my superego do?
Is that the one like you wanted? I don't know how to explain it.
Okay. My id says, Pam, I want pizza. I want tons and tons and tons of pizza. I love pizza, Pam. You could have pizza all day, every day. Pizza is so good. My id is like every day I wake up, pizza, 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 pizza. That's a Little Caesars commercial. My super ego says, no, Pam, you cannot have pizza. You can never have pizza. Pizza is not good for you. It's full of cheese and fat, and you just don't need those calories. No, 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 no. My ego says, Pam, you could probably have a piece of pizza and be okay.
Unbalanced.
So that's my ego. So the question is, when you are working with a client, what part of the unconscious are you working with? It is the ego. Okay. And unless it says, because sometimes you'll see a question that says, a person is driven by their desires. What part is that? But as a rule, all of our therapies work with our ego. Okay, is there a question there? Let's do this one. 36. Okay. I'm going to just move this up a little bit. Okay. A medical social worker interviews a young woman, Jay, who was brought into the emergency room the night before with head injuries, broken jaw, upper body contusions, and abrasions. She will remain in the hospital several more days for tests. Jay explains that she fell asleep at the wheel and crashed. Her husband is present throughout the interview and seems determined to remain. He nods and encourages her as she tells the story. Anybody got some red flags already?
Yep.
Yes, we know what's going on here, right? He nods and encourages her as she tells the story. Jay seems intimidated by the husband's presence. The social worker fears that Jay is not being truthful and the injuries may have resulted from domestic violence. The most prudent course of action is, okay?
Agree.
Now let's chime in here. Let's see what everybody says. What is the most prudent form of action? A, one, continue the interview and record only what Jay has said. B, ask the husband to leave the room and to permit a confidential disclosure. C, graceful terminate the interview and return when the husband is not present. Or 4, file a domestic violence report with the police department. Yes, Barbara, it is 3, 3, 3, 3, 3, 3, 3. It is 3. It is 3. So if I continue the interview and record the facts that she's prepared to reveal, what does that look like? I've written down what she said. Go ahead.
I would say if you continued it, it wouldn't be accurate because the husband, she's afraid.
Exactly. And I've written it down. So if this case ever goes to court, I've written it down. So, I mean, I could say, client states, but hey. Okay. Asking the husband to leave the room. How well is that going to work out for me?
It's not.
What's going to happen?
He's going to get
defensive.
Say again. He's going to what?
Be defensive.
Oh, he's going to be defensive. And if he's sitting right outside the door, is she going to tell you anything?
Nope.
Not one thing. She is terrified of him. Not one thing. And can I file a domestic violence report with the police?
No.
Why not?
Because it's out of your scope.
It is. It is. I cannot do that. I can encourage her to do that, but I don't have that. I cannot do that. Okay.
Child, that's a different story.
Repeat.
I said if it was a child, you would report.
I sure could. What if it was an old person?
Report.
Ah.
What
I can
about
do
if
that.
LGBT you report too? That's what I read in another some.
I can only report whether it's a person who's vulnerable. So whether that is a child or an old person, it doesn't matter if it's a same-sex couple. I still can't report. I can encourage them to, but I cannot report. Okay.
Never domestic violence.
Now I can report if a client comes in and says if they have a disability, then they're a vulnerable population, and yes, I can report. So that's a yes of a disability. Okay. What I can report though is if clients come in and even if they are in a domestic violence situation, and she tells me that when she goes home today, he is going to kill her, I can report that. How come?
Because he threatened to kill her, I guess.
Yeah, she's in imminent danger. If she's in imminent danger, that changes confidentiality rules, right? So I can say to her, please don't go home. Please don't go home. I think you shouldn't. If she chooses to go home, then I need to report that. Okay. What's that called? That law? That act? Tarasoff Act. You got it. Okay. So, however, I cannot report that. And even with adult abuse, does that adult automatically leave the home?
No.
No. Adults have the right to stay.
The child has to be removed from home, right?
The child, it depends on CPS. Okay. My job is only to make the referral with, I only have to have minimal information. Okay. Let's look at 37. A child welfare worker observes red marks and welts on a 4-year-old Asian child. Again, if it says he's Asian, it says it for a reason. His stomach and thighs. The child has been ill. The parents are recent immigrants, and they seem stable and loving. The child seems very well cared for. There are no previous referrals for child protection. The social worker should first. It's our first question. What do I do?
Assess.
Explore, number 2.
I would refer.
What do I have? 1, 2. Let me get some numbers.
1. Oh.
It's gonna be number 1. It's not up to you to investigate it. You just give it to CPS and let them handle it. If it's cultural, they'll decide if it's abuse or neglect.
You got it. That's the exact answer right there. Okay. Even if they are Asian and they probably may not be familiar with cultural norms here, I still have to refer. Okay. So that's one exactly. So that's a first question that many times will throw you off, because what have we been taught about first questions? Explore. And we've been taught that's an Asian child, so it may be cultural. Okay. However, in this situation, the child seems ill and he also has welts. I'm concerned. Okay. Questions on that one? Okay, we're going to do one more before we wrap it up. Okay. 38. Marcia Min, a child protective services worker, is working with Jean, a young mother aged 17. She is a 10-month-old girl who has been abused. Jean also has a history of being abused by partners. When the social worker arrives, the door is answered by disheveled young men who seem inebriated. That is drunk, high, if you're not sure what that one means. From the door, Marcia observes 3 men drinking beers. When she asks about Jean's whereabouts, the man is evasive and gives contradictory answers. He invites the worker into the apartment. The worker should. So type your answers in. Don't let's not discuss it yet. Just tell me what you would do. I see a 4. Come on, give me some answers, guys. Be brave. A 2. A 2.
A 2.
A 2.
Sorry.
It is a 2, okay? I'm going to exit as quickly as possible and return with an agency or police escort, whatever your agency decides, okay? How come I just can't return later when Jane's available?
Safety. You still have to assess your own safety. And you can't, if you're not safe, you can't be a protective factor for the child.
Well, that's number 4. If I can return later when Jane's available, that doesn't address my safety. I can't return when... Go ahead.
Safety of the child.
Safety of the child. Dude, she's 17 with a 10-month-old, and the men they're giving me mixed messages. She could be dead in one of their cars, right? Hidden in the closet. So I cannot wait. This is definitely a concern, right? And one of the things that we know when we're even looking at child abuse or some kind of abuse in general, when people give contradictory statements, right? So if you tell one person something and somebody else something else, then I'm definitely concerned. Okay? So cannot walk away. Am I going to the apartment?
Mm-hmm.
Now we all know some of y'all in this group would, okay? we all know is those people who would. Don't. Don't. We are social worker. We think we have this big old S on our chest. We're walking in like we're big and bad. Don't do that. Don't. There are 3 men who are drunk and you could never be heard or seen from again. Don't do that. That is dangerous. Okay? So I'm going to leave this quickly and then I'm going to come back with the police because I need to make sure that girl is not dead in that apartment. Okay? Why are you confused, Barbara?
Well, I guess I understand now because most likely these men don't live there, right?
They may live there.
Yeah, so I don't understand. I don't know.
Why I wouldn't go in?
Well, not about going in. I said just return later when Jean's available.
Okay. Because she's 17. She's got a 10-month-old who has been abused. Okay. She has a history of being abused by her partners. And the key there also is the men are giving contradictory answers and they're evasive.
So they're like lying to you or something.
Something's going on. Where's Jean? I don't know. I haven't seen her in a week. Where's Jean? If they said she's at work, I go to work and she's there, we're good.
Oh, okay.
The concern is that the answers that they're given, okay? That's the concern.
Okay.
And they didn't say where are the babies.
Or where's Jean? We have no idea. Okay, so I'm concerned. I'm really concerned. So that's why. If I went to the house, and even if all 4 men lived there, even if they were drinking, and they said, you know what, she went to the store, she'll be right back, or she's at her mother's house, someplace that I can validate, I wouldn't be concerned.
So pretty much because they didn't tell you where she was, we're worried about that?
Because they're evasive and give contradictory answers. Contradictory means one man said something, one man said something else. So all of their answers are not the same. That's
Right.
always a red flag. Okay, so that's the vocabulary, those contradictory answers.
Okay.
Okay,
Mm-hmm.
that's what sends up my red flag. Other questions? Okay, guys, we're going to wrap it up for today. Was today's session helpful? Did you come over across some things that maybe you hadn't heard or seen before?
Yes, very helpful.
Yes.
Okay, so I'm going to do it again next Sunday. We're going to we'll probably start off again the same way, then more focus on content. We're really going to focus hone down on the theories. I'm hoping to offer a Saturday class as well as my Sunday, but right now I am totally booked. The NCE, I tutor for that one too, and that big test for most of my people is coming up pretty soon. So once I get them through that, I'll offer up probably another Saturday class. So what you will get, I will make sure that this is in the chat room, the box, if you'll come back probably later on tonight. All the questions and answers will be in this chat box, as well as the videotape. And the link is there. If you right click it, you can save it to your desktop. It'll be in this space for 30 days. However, if you forget to right click it or whatever, just send me an email and it's I'll send you the YouTube link where you can go back and watch it over and over and over again. And again, mostly all you see is the questions, not my face. So if I already have you for individual sessions, good. If I don't, and if you want individual, I do individual. And if not, we can just do group. My goal really is just to kind of help you get through this. Now that we've explained it or we begin to explain it, does it seem like such a mystery?
No.
It's really not. I mean, I'm not trying to minimize. I'm not, because it's a lot of content you have to learn. But if you understand how to answer the questions, it's not near as difficult as it can appear to be. Okay.
Do you know what next week will be on?
I'm going to start with theories. I'm going to start with the developmental theories. It'll be Piaget, Bandura, all the developmental people.
Okay.
Okay, and it will be the same time next Sunday. I'm hoping probably by the end of October we'll offer a Saturday and a Sunday session. Okay.
Okay.
Other questions? Okay. I will put my phone number in the chat box if you hadn't, and if you're not following me on Facebook, be sure you follow me. I try to post like all the time just to kind of keep up.
Next week at 6 o'clock, 6 p.m. again, not 5.
Same thing at 6 o'clock, and it'll be on developmental theories. It's the same link every week. The Saturday and Sunday, the links don't change. Okay, so once you have the link, you always have it. Okay. And again, that is my phone number. You can email me. This is my email. You can, that is my phone number. You can always message me. What is the difference between the NCE group and the social work group? Not a lot. If you want to attend the NCE groups, on my Facebook page, I post what we're talking about. Some of the NCE test has a lot more theories. There's some vocational theories in there about vocational stuff that social workers don't have to go. But when it comes to like mental health diagnosis, and kind of, again, Piaget, all of my developmental theories, it's exactly the same. Exactly the same. Today I did social and cultural diversity, and it's the same thing that we say as social workers study. Okay. I got to go. Another one coming up. So again, I'll get back to you. When I hang up, the link will be there, and I'll be sure to email you information as soon as I can tonight. Okay. It's been a pleasure, guys. You'll get a Survey Monkey in this box also. Be sure that you felt the Survey Monkey. That gives me information on how I can improve so we can get all of you pass through this test. Thanks a lot for attending. I'll see you guys next week.